and pharmacy costs. Why are they so high? On the 11th, we're going to have a legislative update, a North Carolina legislative update. And then on the 23rd, we're going to have a class on direct primary care. So for anybody that's been interested in direct primary care, we certainly invite you to join us there. With all that being said, let's go ahead and kick us off this rainy Thursday. Thank you both for joining us this morning, and I'll turn it over to you guys.
Well, good morning. On behalf of the commissioner, who is in Wilmington, probably still meeting with residents down there concerning the tornadoes that went through in Brunswick County on, I think it was Sunday night or Monday. He's been down there for a couple of days to visit with residents, and there's been an emergency assistance center set up down there. So on behalf of Commissioner Causey, we thank you for the opportunity to share with you today, and hope everyone is doing well. My presentation is very brief. I'm sure you don't really want to hear from me as much as you do Melinda, because she has some really great information to share. So I'll just move forward. So just for the agenda for the agent services part is just an overview of agent services. We've had a little bit of a reorganization, and then just to give you some statistics, some consumer advocacy numbers, and I'm not an expert on the No Surprise Act or the transparency provisions, but I'll share some brief information so that you can have that, and I've been given that by someone in the general counsel's office. So just full disclosure on that. Melinda, can you, I can't read this because of this. I'm sorry, excuse me. Technology is not my thing. Thank you so much.
You're welcome.
Okay, so the Agent Services Division has a call center and a communication specialist section that responds to the inquiries that come into ASD. If you call in and say, how do I get licensed, or what is my continuing education requirements, things like that. How do I get appointed? Who is currently appointing me? They field those calls. In addition, there's a licensing section that processes license applications that have been referred by Pearson VUE, which is our third-party vendor, and they also process appointments. Those two sections have been combined to hopefully give you better customer service, to have layers of cross training so that we don't have any downtime should someone in the licensing or call center section, which are fairly small sections. So if someone's out sick, and then we've learned with COVID, if someone's out sick and then someone goes on vacation, we don't want you to see a break in service. So we have combined those two units. And so if you have any feedback about that, I'd welcome that, because that is new to the division just this month and then the last week or two. We have a continuing education section which handles your pre-licensing, and if you have any questions about putting in a course for approval, or if your credits aren't showing, or anything like that, then that's certainly the section that you would need to contact. You can call in through the 807-6800 number, and they will put you in contact with that employee. In addition, we have a compliance section which handles the complaints that come in from other state agencies, from companies, from other divisions within the department, from other states through the NAIC and the RIRS, that's Regulatory Information Retrieval System. We handle those complaints, and we have an agency investigations division, which you may or may not have had contact with. They do routine and target investigations, as well as compliance checks throughout the state. So a routine investigation is just one where they go in every 3 years or so, and randomly they pick an agency and go in and check the financials as well as the underwriting. And so they just go in to make sure that everything is running smoothly and that you're meeting all the statutes and rules. And then there's a special projects unit which distributes the newsletter. I hope you've been getting those. If you haven't, please email me personally and I'll make sure that your email address has been updated properly on the system. And we send out email blasts, which include memorandums, bulletins, and just hot topics. For consumer advocacy, the Consumer Services Division received 39,770 calls in 2020. They recovered over $17 million for consumers. They assist consumers in finding lost life insurance policies that would otherwise go unpaid. So if you or someone, one of your clients or someone you know has had a loved one who passed away and you want to see if there's a life insurance policy that perhaps they didn't keep paperwork for, or they just that they're not aware of, then there's a form that you can fill out that you send in with to Consumer Services, as well as the required paperwork, and they will contact the companies to see if there's a policy out there. Last year, they assisted 2,350 consumers in recovering over $55 million for those consumers. During COVID, as we'd previously let you know, the department has asked the health insurance companies to be flexible with the premium payments and to allow telehealth office visits. We'll continue to encourage insurers to allow that flexibility using telehealth for as long as necessary through the pandemic. And I guess we'll revisit that even afterwards. On the agent services side, we issued over 89,000 licenses last year. We handled 1,710 complaints. We had 226 investigations. That includes routine, target, and compliance checks. And we received over 27,000 calls in the agent services division. As I shared earlier, I have been given this information from a representative from the General Counsel's office concerning the No Surprises Act. That's a title of division of the Consolidation Appropriations Act of 2021. It's comprehensive new protections against surprise medical billing for plans or policy years starting on or after January 1st, 2022. So I'm sure you're going to get some additional information on this. The Act also contains transparency provisions as well. The No Surprise Act prohibits surprise bills. Patients are only required to pay the in-network cost sharing or for out-of-network emergency care and ancillary services provided by an out-of-network provider at an in-network facility, and for out-of-network care provided at an in-network facilities without the patient's informed consent. So they have to consent for it to be billed any other way, and that holds patients harmless from the surprise air ambulance medical bills as well. There's binding arbitration is required to consider the market-based median and in-network rate alongside the relevant information brought by either party. Information is requested by the reviewer, as well as factors such as the provider's training and experience, patient acuity, the complexity of furnishing the item or service in the case of a provider that is a facility, and teaching status, case mix and scopes for services of such facility, demonstration of good faith efforts or lack thereof to enter into a network agreement, prior contract rates during the previous 4 plan years, and other actions. The bill charges and public payer rates are excluded from consideration. And the No Surprise Act requires health plans to provide an advance explanation of benefits for scheduled services at least 3 days in advance, including the network status, of the providers. If the provider leaves a network and allows patients with complex care to have up to 90 days period to continue coverage with the in-network cost sharing. And the transparency provision bans gag clauses in contracts between providers and health plans that prevents enrollees or plan sponsors or referring providers from seeing cost and quality data on providers. It also bans a gag clause that prevents plan sponsors from accessing the identified claims data that could be shared under HIPAA business association agreements with third parties for plan administration and quality improvement purposes. And it requires health benefit brokers and consultants to disclose to the group health plan sponsors any direct or indirect compensation that the brokers and consultants may receive for referrals of services. It extends similar protections to consumers with respects to individual market coverage and short-term limited duration insurance. This requires health plans to report information on planned medical costs and prescription drug spending to the secretaries of HHS, Labor, and Treasury. And I think this is the last one I have on this. It will apply to individual, small group, and large group plans. They will need to enact rules to help to implement the act, and the department is still waiting for guidance from the federal government to understand how these changes will work. And then I wanted to again bring up the mobile app that you can download that will help you provide you with daily information concerning your continuing education. It also gives you a listing of courses in your areas, and it provides blast when we have emergencies and other things. So that's an important app that we have developed, and we would encourage you to use that. And that's my portion. As I said, it's very short, but I hope it's been helpful. And I'm sorry, I'm not very well versed in the Surprise Act, or the transparency clauses, but as that moves forward with the new administrations, I'm sure you'll gain additional knowledge to that. On the agency side, Bill, at the legislature, I'm not sure of anything that the department is pushing that would affect your industry or your oops, I went back, or your licensees or consumers at this time. I'm gonna push this over to, well, I'm gonna clean it first and then give it to Melinda in case I have cooties and she doesn't want them.
Well, thanks, Angela, for that update on a couple of these really important legislative items. Just so that everybody knows, we can work on putting together a policy paper for you on the Surprise Billing Act. There are a couple of very important tenets to that legislation, and we've certainly talked about it at the federal level with all of our legislators. And we'll also be covering that during our legislative update and lunch next month too. So expect to see that from the Triangle. So, all right, Melinda, take it away.
All right, well, thank you, and good morning, everybody. I'm going to say Happy New Year. It's hard to believe that we're already nearing the end of February, and I hope that you all and your families are safe and healthy. Today, I wanted to focus on a variety of things, and you're probably looking at this agenda and thinking, oh my word, these are some pretty random topics. But I feel that one of the great values of the collaboration between you all and the department, specifically SHIIP, is that I can share with you things that we are seeing or hearing about from consumers on our side of things, and And I think that's so beneficial as we work together to support specifically the Medicare beneficiaries. And then likewise, if you're running into similar things or other trends, to let us know, because we can then share that information with our network, specifically the Centers for Medicare and Medicaid Services, the Administration for Community Living, and the National Council on Aging. So I think we're all probably taking a little bit of a collective sigh of relief following open enrollment. It was very different. As I tell anybody that says to me, that will have often commented with, gosh, Melinda, I bet it was extraordinarily challenging as a result of the pandemic. Yes, but I've been doing this for so many years. Every single open enrollment presents some type of challenge. I'll tell you from the aspect of SHIIP, our office, the Department of Insurance, has been open to the public since June of last year. Most of the staff, truthfully, is working from home. We were able to provide scheduled telephone counseling, virtual counseling, whether it was Zoom, Microsoft Teams, for the beneficiaries that felt comfortable doing that. However, we did have folks that continued and wanted to come in and meet face-to-face, and we were able to accommodate those needs as well. So as we get started here, I thought I would just highlight a few of the changes as it relates to Medicare for 2021. On a good note, I think we can all agree that now beneficiaries with end-stage renal disease can now join a Medicare Advantage plan, and this is a result of the 21st Century Cares Act that amended the Social Security Act, allowing this to occur. This provides greater options to folks with end-stage renal disease, and so I think that is just a great example of providing greater opportunities to Medicare beneficiaries specific to end-stage renal. In addition, Medicare now covers up to 12 acupuncture visits, in 90 days for chronic lower back pain. And they will cover an additional 8 sessions if improvement is shown, but no more than 20 treatments will be covered annually. And big improvement there as well. For many, many years, Medicare didn't cover acupuncture at all. So nice to see that that is something that's available to Medicare beneficiaries. The last bullet I have on here, I'm going to go into far greater detail. And that is the Part D senior savings model that became effective January 1 of 2021. And this is a voluntary model that enables Part D plans who offer enhanced coverage to lower the out-of-pocket costs, for insulin. Currently, 1 out of every 3 Medicare beneficiaries has diabetes or is diabetic. And I'm sure all of you are aware that the cost of insulin have skyrocketed in the past few years, to the point of, we have spoken to so many people who are just unable to purchase it, and they are lowering the a dose that they are administering to themselves, just trying to spread that out. And as you know, that's such that's a scary thing for a diabetic. So the model is certainly shared between participating, can't even say that word today, pharmaceutical manufacturers, and then Part D plans. So plans that chose to participate have a cap of $35 for the cost of some of the insulins for a 30-day supply. And that's wonderful, because that's predictable costs for the beneficiary, whether that's in the deductible phase, the initial coverage level, or in the coverage gap. And that pricing is for both vials of insulin and pen injectors. So for 2021, there are 3 pharmaceutical manufacturers that were approved, that applied and were approved, and that is Eli Lilly, Novo Nordisk, and Sanofi Aventis. And I actually, in full disclosure, did the pronunciation app yesterday to make sure I said that correctly. So forgive me for my pitiful French. But, and then what I've done here is included the link to the list of the model drugs that are included under those 3 pharmaceutical carriers. So after CMS received the RFA for the pharmaceutical companies, subsequently they sent it out to the Part D carriers. And in North Carolina for 2021, 9 of the 31 standalone prescription drug plans and 52 Medicare Advantage plans with the prescription drug plan will participate and offer the out-of-pocket insulin costs through the Part D savings model. What I've included here is just a pictorial chart of how the senior savings model is going to come to fruition. I think it's a good illustration that you can see on the left, the non-model Part D plan, where the consumer's average out-of-pocket cost is $675 compared to that on the right, where it would be $229, which is a significant savings. And as it states on this model, it's an average savings of about $450 per year for each beneficiary. So wonderful, wonderful thing. Part of the Part D senior savings models included some waivers, and I didn't list all of them, but there is one that I wanted to highlight because this is something that we just learned about recently. So part of the waiver is with the low income cost sharing subsidy calculation. I cited the federal statute there, and it says, to the extent necessary, calculate the low income cost sharing subsidy for a model drug based on the cost sharing of the formulary tiers for the model drug without regard to any model specific supplemental benefits for such drugs. So it's a lot of words. So what does this mean? This Part D savings model is beneficial, to so many Medicare beneficiaries, but there is a pocket of the population that is being adversely affected, and that is beneficiaries who qualify for partial extra help. So extra help is the federal assistance program that is available to Medicare beneficiaries to help pay for their Medicare Part D premium and subsidize their cost sharing for their prescription drugs. If somebody's receiving full extra help, if they select one of the plans that have been deemed for to be a $0 premium, they would pay $0 premium, and then they would have a set copay for generics and brand name drugs. However, there's a portion of the population that may not qualify for full extra help, but they may qualify for partial. So that would be 25% subsidy, 50% subsidy, or 75%. And what is happening with these individuals, and we've had 2 that we were made aware of just this past month, they are being charged a percentage of the full cost of the drug based on their level of subsidy. They are enrolled in specifically one of these plans that is part of the model. So they are not being charged $35 for their particular drug, but something in excess of $280. That's a problem. So we have reported this to CMS. We've reported it to ACL and the NCOA. They are aware of it. The plans are not doing anything wrong because it's part of the waiver that was included by the feds, but we think this is a real problem for these consumers, and we're hoping it's something that they address. So in the meantime, you think $280 is still, that's extraordinary for anybody to have to pay, but certainly for people who are already receiving some sort of subsidy. We are encouraging these consumers to seek out prescription assistance programs. These drug manufacturers have pharmaceutical assistance programs. Historically, if somebody were on Part D, for example, they may not provide any assistance, but I always go with there is nothing wrong with asking, and the worst thing they can say is no. It's my understanding that Eli Lilly is providing assistance to these consumers. That would be more the Humulin drugs, but there are so many different insulin medications. Like I said, this is just something concerning to us, and I wanted it to bring it to your attention should you have any clients who may fall into that bracket of partial extra help that enrolled specifically into one of the Part D plans who are participating in the savings model that may be having to pay or being charged a significantly higher co-payment for those drugs when they were under the impression they would be paying $35. So next, you're all going to love this. I know you are, just about as much as I do. And you're probably going to cringe when that last one pops up. I feel like I saw the commercial with Joe Namath every 5 seconds. The Medicare helpline, whether it was him, Mike Ditka, Bill Engvall, Meredith Vieira, consumers were inundated with these ads during open enrollment. And quite honestly, I saw the Joe Namath commercial just again the other night. With that, what we found is that our calls shifted so much as a result of these particular commercials. And because they highlighted so many of the supplemental benefits. So I wanted to talk a little bit about this. And again, I know you guys know this, but I just think it's important. So the supplemental benefits have been around for a long time, certainly since Part D, or excuse me, the Medicare Advantage Part C program started in 1999. And then in 2006, special needs plans started to incorporate those as well. So there was a long-standing rule that the plan benefits were offered uniformly to all enrollees residing in the plan service area. So I think specifically of silver sneakers, that was one that we heard a lot, or consumers would say, gosh, I heard that this particular plan offers dental or hearing or vision. So parts of, they were supplemental benefits that were provided beyond that were found in original Medicare. So what happened in 2018 as a result of the Bipartisan Budget Act is that these supplemental benefits were expanded for the chronically ill. And I've provided that bit of a definition. I'm not going to read that for you. But essentially, it allows Medicare Advantage plans to offer benefits that are both not primarily health related and offered non-uniformly to eligible chronically ill beneficiaries. So I always think, what is the definition of a chronically ill person? Well, it is a person who has one or more comorbid and medically complex chronic conditions that is life-threatening or significantly limits overall health or function, has a high risk of hospitalization or adverse health outcomes, and requires intensive care coordination. And I've provided an example, a list of examples, excuse me, that includes diabetes, COPD, congestive heart failure, past stroke, hypertension, coronary artery disease. Basically, I think you could pick 1 out of 1 Medicare beneficiaries, and the likelihood is that you're going to find somebody that would fall into that definition of chronically ill. So with that, I provide a list of the special supplemental benefits. That's the key word here, is the additional special benefits for the chronically ill. So what we are hearing now is meals beyond a limited basis, food and produce, transportation for non-medical needs, my favorite, pest control, programs and events to address social needs, structural home modification, and general supports for living. So back to those commercials, out of the phone calls we received, if I had a nickel for every time one of my staff heard from the consumer, from the caller, I want that plan, I want what Joe Namath was talking about. I want meals. So initially we were frustrated because we thought, this is so wrong that this is how they are enticing Medicare beneficiaries to contact them. But we all decided to change that and looked at it as an opportunity for us to emphasize the importance of the health insurance component of these plans, and that we talked to them about provider access and thinking of their pharmaceutical needs. It provided us an opportunity to screen for extra help, because if they're saying they need home delivered meals, it likely is that they're in a situation where maybe their income has changed or their circumstances have changed where they're needing that extra help. So we're not social workers, we don't pretend to be, but we do want to provide resources to folks in terms of if it's something that's going to help them with those sets of circumstances. So we were able to refer these individuals to area agencies on aging in their region to find out about senior nutrition programs, including Meals on Wheels and congregate meal sites. In addition to that, we also encourage them to talk to an agent. So, you know, that is, sorry, there's a little bit of background there, but we ended up going in that direction. So what I wanted to share with you all, though, were some tips that we have been employing as well. So when they were calling the Medicare helpline, those MA plan customer service representatives cannot confirm that a potential plan member will be eligible for those SSBI-CI benefits prior to the enrollment. They can't. So be on the lookout for those folks. So if you have clients who are enticed to change based on those commercials, based on those circumstances, and it's not the right fit for them, we can use an SEP for a contract violation to get them out and get them into better coverage. In addition to that, though, if you have a client that you helped go into one of these plans, or but they are being denied the services for the SSBCI, we can assist with filing an appeal for those situations as well. I want to switch gears now and talk a little bit about IRMA, and I'm not the income-related monthly adjustment amounts, because this is something else that we've had several conversations with a number of beneficiaries. So I'm sure you all know that it is a surcharge that a higher income bracket people may pay in addition to their Medicare Part B and Part D premiums, if applicable. Part B IRMA went into effect in 2007. Part D IRMA went into effect in 2011 following the ACA. The Social Security Administration is the one who makes the determination for IRMA, and they use information from your income tax returns 2 years earlier. So, and it's calculated every single year. So certainly when people are working and maybe retiring, their income that they reported 2 years ago could be very different than what it is today. And sometimes it's a significant difference. So it is calculated every single year. So if someone does have to pay an adjustment 1 year, it's possible that they would fall below the threshold the following year and not have to pay the IRMA adjustment. So I included this chart because I think it's helpful that how IRMA works for Part B versus Part D. So again, Social Security is going to send what's called an initial determination notice to the beneficiary, letting them know if they are required to pay an IRMA. For Medicare Part B, the amount is automatically added to the Medicare Part B premium, excuse me, for that year. For Medicare Part D, the amount is in addition to the Part D monthly plan premium. For Part B, for most people, that amount is automatically going to be deducted from their Social Security or Railroad retirement benefit. If they are not receiving retirement benefits, then they make those payments directly to Medicare. On the Part D side, we always emphasize to folks, if you go into a Medicare Advantage plan that includes prescription drug coverage, you're still going to have to pay that Part D IRMA. But the payment is made to Medicare, not the Part D plan. And again, that all of that information is included in that initial determination notice from Social Security. If they are receiving retirement benefits and collecting that from Social Security or Railroad retirement, that Part D IRMA will be automatically deducted from their retirement benefit. Again, if they are not receiving retirement benefits, then they need to make those payments directly to Medicare. And failure to pay the IRMA amount can result in a loss of coverage. So why I want to mention this is income is changing for people, and they're trying to find ways to certainly minimize what they're having to pay. And if it's a situation that someone says, listen, I've had a life-changing event, you know, my spouse passed away, marriage, divorce, they can request a new initial determination from Social Security. They need to contact Social Security directly, and I've provided the phone number there. But if they didn't have a life-changing event, they can also request that Social Security revisit the decision if the beneficiary believes that the income information that Social Security did use in determining IRMA was incorrect. Maybe they filed an amended tax return, or they have a more recent return that shows the individual is receiving a lower income than previously reported. Again, it's something that we are encouraging folks to contact Social Security to see if there is a way they can review that. If after requesting that it still is not favorable, the consumer can appeal the IRMA decision. I have never had anybody win one, I'll be very honest with you. And the hardest part is there's no time frames with Social Security to respond. But again, they can file the request with Social Security. If it is successful, the premium amounts will be corrected. If it's denied, the beneficiary can continue through the appeals process of the Office of Medicare Hearings and Appeals. But again, like I said, to be honest with you, we've never had a consumer that's gone down that road successfully, but I just wanted to let you all know that that was available. And then finally, obviously, we're in the midst of the Medicare Advantage open enrollment period, which is a great opportunity for people who are already enrolled in an MA plan. If they want to make changes, they can do that. It is a one-time election from January 1 to March 31st, and the coverage is effective the first day of the month after the plan receives the request. And then we have a chart here that says what beneficiaries can do and what they cannot do. So with that, I do want to circle back to thinking about those folks that maybe were enticed by those commercials and signed up for coverage through like the Medicare helpline or something along those lines. And maybe these are clients that you have assisted in the past, or maybe are just coming your way. As a result of their dissatisfaction with the current plan, they can certainly use the Medicare Advantage open enrollment period to get out. But if it's beyond March 31st, I want you to know we can use that that other SEP to get them out for if it's marketing misrepresentation or so on and so forth. So with that, I know I went pretty quickly, but I just feel again that these types of situations that we become aware of, I want to let you all know. So it's a way that we can help you with the clients that you have. If you are seeing trends that are concerning to you, and whether it's at the federal level, certainly that would be the case, I would suspect, but feel free to reach out to me, because that's good. I always say it's information going down and information going up, that we can work together to support the beneficiaries of our state. And with that, I will finish, but if anybody has any questions, they are welcome.
Well, thanks,
Hi,
Melinda.
Melinda. Melinda, that's a great presentation. Thank you so much for that. I do have a question or a comment as a Medicare agent. You know, we work so hard to try to find people the right plan during the annual enrollment.
Right.
And then to have these other companies come in behind us and switch plans, because if we're within that Medicare Advantage open enrollment period, if one of our plans is switched with somebody else's plan, then we get dinged as an agent, and compensation is removed, and then we get a black mark for, you know, I think the inference is that we didn't do a good job selecting the best plan to begin with. So is there any way you can give us, you can share with us the contacts that you have for the local agencies that provide meals and such, and maybe we can start sharing that with our agents too?
Absolutely. I would be more than happy. It's through the Department of Health and Human Services, the Division of Aging and Adult Services. And Tony, if you'd like, I'm more than happy to email you that link.
Correct. Terrific. Thank you so much. Any
You're
other
very
questions?
welcome.
Yeah, thanks, Melinda. We'll get that out to everybody. I did have one question. I'm just curious, Melinda, what is the most common question or request that you get, you know, that an agent might be able to get in front of when we're doing our, when we're having conversations with, you know, folks that are enrolling?
That's a really good question, Michelle. That's a really good question. Golly, a lot of it is confusion. And I think I emphasized it just in the remarks. You know, I think there is such value in connecting social determinants of health and food insecurity. I mean, North Carolina, we all know for seniors is one of the worst in the country in terms of access to food. And like I said earlier, it used to be this. And truth be told, a lot of what we do, the majority of what we do is helping folks compare standalone prescription drug plans.
Sure.
Hands down. And we, in terms of the Medicare Advantage side of things, always start with, we're going to send you the list of plans that are available in your county. You need to find out what your providers take. Because it's foolish for us to go down this road with folks. I mean, I always say a plan can look great on paper, but if your doctors don't take it, or if it's not covering your prescriptions, then it's maybe not the best one for that individual. Sure. But I think in terms of agents, if for you all, and you do this already, it's just being that ear and highlighting that what is good for one person is good for them. It may not be good for you, but there might be something better for you. And kind of clearing the mud. And that's really hard right now. That's really hard right now because people are isolated in their home. And so television for sure is a way that they are gleaning this information. I use my dad as an example. My dad passed away a few years ago, but his income was such, he was on a fixed income. And so he did not have cable television, couldn't afford it. So he had an antenna and we called it Kenny Cable, but he watched like Me TV and all of those things. And this is where these commercials are happening. I'm like, it is nonstop. So I would say maybe it's counteracting that and saying, I read this article the other day and it was talking when I was preparing these slides, because I really hesitated, but I thought you guys are right in it with us. Like, I'm sure you're sick and tired of seeing Joe Namath just as much as we all are. And this guy wrote in there, he's like, so seriously, I saw this ad from Bill Engvall, but what does he know? He didn't play football. So, right. But it's like, don't get your health information from a football player, for goodness sakes. Get it from somebody that's trusted and knows what they're talking about. So I don't know if that really answered your question, Michelle, but it can be anything from I'm turning 65, I'm confused, I'm getting inundated, and not really understanding what to do. And Tony, if it's okay with you, I'm just going to chime in. We had spoken a few weeks ago, and actually we've been talking about this beforehand, but I reached out to some folks in the Triangle chapter and then in other chapters as well. With SHIIP, you know this, we need to provide unbiased information, and we cannot directly refer to any particular agent or company. However, what I am striving to do is to put a link to the Health Underwriters website on our website, that we can say, if you need to find a local agent, go here, and then they can do that on their own. That I'm not saying, oh, call Michelle Reynolds, here's her phone number, but that they can, it's up to them, right? But then because we always say to them, if you have a local agent, contact them, please do. You guys know it. Right. So I would think, though, just framing it in, I hate to say it, but I would think like, hey, we know insurance, he knows football. Like, would you come to me to know how to run a particular play? No, I don't know that. So
I think it's such a good point, just to piggyback on your comment about your dad. I have a mother-in-law that lives with us, and she's Me TV all the time, every day. And she'll come downstairs and have just these outrageous requests. And I tell her, that is not exactly how health insurance works, for you. It may work that way for some, but not for you specifically. So, well, with that, I want to open this up to anybody on the call that has any questions. Feel free to unmute yourself if you have a question, or you can raise your hand and I can unmute you. Anybody have anything out there?
While you're doing that, Michelle, real quick, I just wanted to say one other thing, if I can.
Sure, yeah, of course.
So part of SHIIP, housed within SHIIP, is a senior Medicare Patrol program. And S&P provides support to Medicare beneficiaries who, in terms of reporting fraud, waste, and abuse with Medicare. And what I wanted to point out is, sadly, COVID scams are just going through the roof right now. And we've had callers tell us that folks are reaching out and saying, if you pay a certain amount, you can get in line quicker to get your COVID test. This is not true. If you guys hear anything like that, if you wouldn't mind just having them reach out to us, it's the same phone number, but we work closely again at the federal level with the OIG's office. We're going to be putting out some information. We're doing that at the state level for sure. Just trying to again educate consumers. Like, this isn't, you're not getting you know, you don't need to pay a premium to get in line, you know, to get a vaccine any sooner than anybody else.
Right. Yeah, I think that's important. I'm seeing that across national news too as a concern. So that's great.
Melinda, I'm part of a Facebook group for Medicare agents, and something that's popping up is this business where they're not insurance agents, but they're offering to help with their Medicare for several $100 fee. And the way they position it is that we're not an agent, so we're not going to get compensated on whatever choice you make as far as Medicare Advantage or supplement plans. It's totally up to you. So we can give fair and unbiased help, as opposed to an agent who's, you know, they're going to drive you to wherever they're going to make the most money or whatever. So I don't know if there's a state law against doing that type of thing or not.
That's a good question, Tony. It might be worth you and I chatting offline, and maybe you can give me some specifics too. Is there, so are they charging?
Yes, they charge.
I mean, they have to be made that, okay.
Yeah, they're charging. They're not agents, they're charging.
And they're not licensed agents. Do you have a name or anything of the?
If I can find it again, I'll forward it to you.
Okay, that would be helpful. Thank you.
All right, well, it doesn't look like we have any questions. I think we've gotten to the point where everybody is they either took it all in and absorbed it, and we appreciate all the information you've given us today, or they're shy. Either way, if there are any questions post our event this morning, I encourage you to email myself, email Tony Gutierrez, or any of us at the Triangle board, and we're happy to facilitate those answers from Melinda and her team at the Department of Insurance. Melinda, thank you again for joining us.
You are so
today.
welcome, and thank you all, and thank you for the collaboration. And I'm sorry I didn't include it in my slide, but I think you all know how to get in touch with Angela and I. It's our first last name at ncdoi.gov. So feel free to reach out at any time.
Well, we will send notes on this meeting today, including the recording, where you can find the recording afterwards. We'll send you some policy paperwork as well on the surprise billing piece. And thank everybody. I want to thank everybody for joining us today. And Melinda, we look forward to doing this again with you sometime soon. Thank you for always being such a great partner to us.
You're welcome. Thank you all. Be safe. Take care.
All right.
Bye-bye.
Thank you. Bye-bye.